Okay, I guess we'll start now. I'd like to welcome everyone in the room, as well as everyone who's joining us online. Welcome to CHI's Patient and Public Engagement Lunchtime Learning Series, a monthly lunchtime learning series. And today we're going to be talking a little bit about safe spaces, brave spaces, and inclusive patient and public engagement in health research. And my name is Carolyn Shimmin. I work here at the Center for Healthcare Innovation in the area of patient and public engagement. We'd first like to make some acknowledgements that we'd like to acknowledge that we are gathered here today on Treaty 1 land, home of the Anishinaabe, Cree, Oji-Cree, Dakota and Dene peoples, and homeland of the Métis Nation. And in coming together today, we respect the treaties that were made on these territories. We acknowledge the harms and mistakes of the past. We recognize, as we are talking from a social justice lens, we recognize the ongoing present-day colonial violence that is faced by Indigenous peoples within our healthcare system, education, justice, child welfare, and government systems. And we dedicate ourselves to moving forward in partnership in a spirit of reconciliation and collaboration. And one thing that I always like to note is when we're talking about patient and public engagement in research, it's in fact Indigenous research methodologies that are at the forefront, and we should be looking at our Indigenous scholars, researchers, and communities as well. Disclosures. Because we are an accredited lunchtime learning series, I must disclose that I am employed by the Georgian Fahey Center for Healthcare Innovation as the Public and Patient Engagement Lead. So before we start off, if you've been to our lunchtime learning series before, a lot of times I start off just with a definition of patient-oriented research, and this is just so that we're all on the same page as we move forward talking about patient and public engagement, that we all are talking about the same thing, because patient engagement is used kind of across the board to mean different things. But when we're talking about it today, what we're talking about as far as the definition of patient-oriented research is a continuum of health research that engages patients as partners. It focuses on patient-identified priorities. It improves patient outcomes. It's conducted by a multidisciplinary team in partnership with relevant stakeholders. And I like to end, it aims to apply the knowledge generated to improve healthcare systems and practices. I emphasize the and because when we're talking about patient-oriented research, we want to include all of these 5 aspects, right? It's more than just looking at patient-identified priorities or improving patient outcomes. It's also engaging patients as partners in research decision-making. And the Canadian Institutes of Health Research, the Strategy for Patient-Oriented Research, define patient engagement in health research as the meaningful and active involvement of patients in the governance of research. So that means having people with lived experience, their families, their caregivers, as part of the steering committee, the research team, all the way at the highest levels. It's around priority setting of research. It's around having people with lived experience conducting research, and also involved in the knowledge translation of research. So how we disseminate and implement the findings. Now, I'll start a little bit with this because we're going to be talking about safe spaces today. And and part of that is talking a little bit about vulnerability. So we know that patient engagement at its core has a lot of aspects that can at times be a little bit challenging, right? So we're challenging our assumptions around expertise, around knowledge. We're upholding the value of experiential knowledge of people with lived experience of a health issue, as well as their families, in helping to actually inform research questions. So trust requires a certain level of vulnerability. For researchers, it's having their academic expertise challenged. For patient partners, it's being open to actually sharing your vast experiential knowledge in order to help improve research decision making. So on both sides, there's a level of vulnerability that occurs. You're going to see me maneuver a little bit. And what that means is, for authentic and meaningful engagement, there's a number of levels that play into it, right? So on the individual level, whether you're a health researcher or whether you're a patient partner, there's going to be things that you're going to have to adopt in order to really have meaningful discussions around decision making. On the individual level, that means being open to critically reflecting on your own social location, how that affects your perspectives and your values and the way you look at health research decisions. It also means building stamina to receive and process sometimes challenging feedback. And this is important, right? Building that ability to take challenging feedback at times, whether you're a health researcher or a patient partner on a team, right? At the team level, there has to be a willingness to do things differently, to allow for space and time to bear witness to one another's stories and one another's experiential knowledge and expertise, and to be able to share power when it comes to research decision making. And that can be tough. And on the engagement level, we're going to talk a little bit today around safe spaces, brave spaces, some of the ground rules or the guidelines that help to support these types of conversations and this type of back and forth that occurs. Because we know the reality is this, that as individuals, we're pretty complex beings, whether we're health researchers or patient partners. Oftentimes we see, well, not oftentimes, but sometimes we see people seeing patients as a homogenous group. So when you're going to engage, well, I'll just engage one person with lived experience of type 2 diabetes. We have to have a better understanding of people bring different individuals' economic, political, cultural, subjective, and experiential lives intersect in a lot of different intricate ways, and we have to account for that, and we have to start thinking about that when we start developing our engagement strategy so that we have a diverse group of perspectives, right? And we've talked a little bit in our previous talks around sometimes patient engagement strategies exclude certain voices. So people who may not identify as patients, people who may have a lack of access to healthcare systems and services, whether it's because of geographic barriers like rural versus urban, but also thinking about systemic barriers. So systemic racism, homophobia, sexism, ableism, sizeism, transphobia, all of these aspects that can play into the healthcare experience and whether we can access the services that we need. There's also stigma that's associated with the term, especially if we're talking to people with lived experience of mental health or substance use issues. So the term patient may not even kind of encapsulate that experience. There's also people who may refuse to engage or prematurely exit the healthcare system due to unresponsive or disrespectful care. We need those voices as well, right? We need to include those voices as well. And then we have people who living with disabilities who may feel like they're continuously medicalized in the healthcare system, so we need to understand how we can better engage in that way as well. And we know that as human beings, look at this, the number of different things. We know as human beings we're shaped by the interactions of different social locations or categories in which we inhabit. So when we think of race, ethnicity, indigeneity, gender, class, sexuality, geography, age, ability, immigration status, mental health issues, religion, all of these different things play into how we view certain things, how we look at how we receive healthcare services as well. And so it's important to remember that we inhabit all of these different pieces of the puzzle. And so when we think of systems of power and oppression and inequality, there are people, it's seen as kind of a coin that we can flip, and on the top of the coin where you experience, so before we see different social locations that are on the privileged side, that's if you have it on the top of the coin, if you experience privilege, You have advantage, others do not. You did not earn it, and you have it because of who you happen to be, so where you inhabit, what social location you inhabit. Then the coin itself is the social structures that produce and maintain those inequalities. And then on the bottom of the coin, you have disadvantages others don't have, you didn't earn it, and it's based on who you happen to be. So having an understanding of this is really important. Having an understanding that the top of the coin, the people at the top of the coin oftentimes have huge blind spots and the way systems of power work is that you don't actually oftentimes recognize the privileges that you may have until it's called out, right? So thinking about all these things when we're starting to engage, and we know it's important to engage different voices because we have all the evidence to show that social and economic conditions and their impacts on people's lives determine risk of illness, actions people are able to take to prevent illness, and then treating illness when it does happen. So we have that information. So we need to so when we're developing engagement strategy, we need to have diverse perspectives engaged. So questions always to ask is, who is affected differently by this health issue? So thinking about gender expression, race, socioeconomic status, ethnicity, indigeneity, culture, all of these different things, who's affected differently? Who has different access to healthcare services associated with this health issue? When I say where are patients at with their health issues, so even sometimes thinking about things like newly diagnosed versus living with a chronic health issue for 10 years, making sure you have all those different perspectives included, but also understanding that when you bring these groups together, that there are these different experiences that will be coming out. And then how am I going to ensure that you bring a diversity of perspectives together? It's important to start thinking about your participatory approach and where you want and how you want to meet people. So when we start, a lot of times nowadays when we talk about patient and public engagement, we hear the term safe spaces. And this comes from social justice learning and activities. And oftentimes people are like, well, why are we using social justice learning activities in patient and public engagement? Well, as we were just talking about, I think it's clear that when we're bringing all these perspectives together, there may be times where experiential knowledge that patients bring to the table and even health researchers bring to the table may be intertwined with experiences of systemic oppression, racism, sexism as well, and understanding how these interplay, how these conversations can work among teams. And usually when we talk about safe spaces, one of the pieces of the puzzle is establishing ground rules or guidelines for conversations and behavior, and that's pretty foundational to the piece of the puzzle, so that we can engage diverse perspectives and that we can actually challenge one another, some of our assumptions that we have around expertise and knowledge. And so the term safe space has been often used in the past, and it's oftentimes we're hoping to reassure patient partners and health researchers that who may be feeling anxious about coming together and engaging, that they'll be able to share their story and feel like they are comfortable enough or safe enough to share those pieces of the question or pieces of their experience. But the question then becomes, to what extent can we really promise everyone the kind of safety people might be expecting when they come together to engage? Because oftentimes when we use the term safe space, we're thinking of an environment in which people can kind of participate and honestly struggle with challenging subjects and feel comfortable. But the problem can sometimes be, in what some social justice people have started realizing, is that there can be a conflation between safety and comfort. So oftentimes if someone is challenged on something, they may say, well, I don't feel safe. But what they really mean is, I don't feel comfortable. And having that understanding is really important. because there is a difference, right? So we need to make sure that our understanding around some of that traditional language is used, and that we shouldn't, that engagement shouldn't be about convincing both health researchers and patient partners that there'll be no risk involved, that there won't be any challenge, that we'll all be comfortable and have conversations where we won't have some debate going on. And because that's simply impossible to confer that, right? So we start thinking about genuine dialogue and just around research decision making, and kind of acknowledging that there are going to be times where we're going to disagree and where things will get emotional. Oops, sorry. And because safe space, how it's been defined in the past, has been around, that we can struggle, but that we're going to still be comfortable. There's been some criticism about the idea of safe spaces and whether we need to flip the paradigm a little bit more to ensure that we can have rigorous kind of debate and challenge each other's perspectives, and still make people feel like they're okay in that situation. And so we start. And so for what happens is the dynamic, it happens oftentimes with people who hold who inhabit social locations where they have some unearned privilege. Oftentimes will invoke, when someone challenges that perspective, we'll invoke the safety thing. We'll say, you know what, this is not making me safe, and try to shut down the conversation. And then on the opposite side, people who experience systemic oppression may also feel like the idea of safety is non-existent, because when we look at systems of power and oppression, there's a lot of places that aren't safe, and even our healthcare systems may not be seen as safe, or academic institutions may not be seen as safe. And so we have to be really cognizant of this dynamic that occurs. So brave spaces is an idea that came about in the last couple of years, and we see it more and more, even in patient and public engagement. And it was coined by Brian Ario and Christy Clemens, and it's a work from a 1998 critique of safe spaces, saying that the importance of bravery has to be emphasized, because learning necessarily involves not merely an amount of risk, but the pain of giving up former conditions in favor of a new way of seeing things. And that happens a lot in patient and public engagement. We have to give up some of our perspectives in order to come forward. And just like safe spaces, the process still has establishing ground rules and guidelines around these conversations. And oftentimes, if you're facilitating some of this work, you may find, if you don't have a lot of time at the beginning, you may bring in some predetermined guidelines and rules ahead of time. But the piece of the puzzle that's more we really want to emphasize is actually having conversations with your patient partners and health researchers to come up with the guidelines together, to have a mutual understanding of what makes us feel not safe, but what could we do to have a brave space. And it has to be an ongoing dialogue versus a one-time kind of piece of the puzzle, and that's something we've learned over the years. And so looking at some of the guidelines. So originally in safe spaces, a big piece of the puzzle was around agreeing to disagree. And so this is kind of an implicit ground rule in disagreements, kind of welcoming people to voice disagreement when their views contrast. However, the whole idea of agreeing to disagree can be used to retreat from conflict in an attempt to avoid discomfort and the potential to damage relationships. And so, but what social justice theorists have been starting to think about is that some of the richest learning that we can have springs from exploration of conflict, right? And so retreating is not always good. We need to have that conversation around and understand the opposing viewpoints. And figure out, so agreeing to disagree too oftentimes means people can bail out if they're challenged, right? You can say, well, we're just going to agree to disagree on this fact and move on, right? But in this, so what Brave Spaces have started saying, the alternative to it is controversy with civility. And this is supposed to encourage courage in the face of conflict and continue rather than stop the dialogue process. So without such a guideline, we're kind of compromised in our ability to kind of facilitate that learning back and forth, right? If people can just say, well, we agree to disagree and back out, then you kind of have that piece of the puzzle. You miss that opportunity to really challenge one another. So we want to, so it's kind of a value whereby different views are expected to be honored, and there's a group commitment to understand the sources of disagreement and to work cooperatively towards common solutions. And it frames conflict not as something to be avoided, but a natural outcome of when we come together and have these conversations. So we're emphasizing the importance of continued engagement through conflict. And indicating that this is something that actually strengthens our engagement versus breaking it down or weakening it. A note on the term civility, because this is a contentious piece of the puzzle as well. Civility doesn't mean that you can't have strong emotions. We still want to keep open the fact that we're going to have some strong emotions and we're going to have some rigorous challenge, and that space is good. So we don't want people to feel restrained from participating for fear of somebody disengaging. And that can often happen. People in positions of power and privilege will disengage if they are rigorously challenged. And so we don't want to restrain people from challenging them. We want to take care, though. I think the reason the creators of Brave Space wanted to take care of not replicating certain oppressive behaviors that are denoted in patriarchal systems where there's a more aggressive piece of the puzzle. So just understanding that we can have high emotions and rigorous debate, but understanding that there's that level that we need to understand. Another piece of the puzzle that often is around safe spaces, and this is often kind of one of those used rules in safe spaces that goes along with no judgment and it's okay to make mistakes. These rules seem to be intended to encourage people to participate, which is really important, but participate in a way that may be dispassionate. We kind of want to say you can participate, but we're not going to take things personally, and it primes partners kind of for the inevitability that maybe there will be times where they say something, where they make a mistake or they do a misstep, and not to take it personally. And it can be reassuring to patient partners or researchers who are concerned that at some point in time they're going to say something out of line, that if we have this rule, it's going to help us kind of navigate that piece of the puzzle. And there's a shared desire for that authenticity and see that value there. But the alternative to this, because it can again be used to shut down conversations, the alternative is own your intentions and your impact. So sometimes we say things and we didn't intend them to harm someone else, but they do. It has an impact, it has harmed someone, and it doesn't. And oftentimes what happens is when there is conflict, people will just say, well, that was not my intention. And they'll try to shut the conversation down without exploring the impact. And the person who's been negatively impacted, who had the courage to say, hey, what you just said, or the idea that you just presented was maybe heterosexist or racist, or it came off as ableist, it stops that conversation. So what is a good conversation to have with your group is that we're going to own our intentions, but we're also going to own the impact of what we say. So if we do say something and someone says that it's impacted us negatively, we do need to have that conversation and rumble with it. You can't just say, well, that wasn't my intention. You have to actually have that conversation moving forward. And that's what Brave Spaces is all about. Challenge by choice is another rule or guideline that oftentimes comes up, and it comes from, again, a social justice learning around. So meaning individuals will determine for themselves if and to what degree they are going to participate in a given activity, and this choice will be honored by both researchers and patient partners when we start engaging. And the principle of challenge by choice is supposed to highlight the important truth that though a given discussion or an activity may provide a challenging opportunity for partners or researchers, some of that learning may be done internally, and that we might not see it happening, but internally people may be processing that. So patients or researchers may not externalize evidence of the degree to which they are being engaged, but this doesn't mean that they're not wrestling with some difficult questions or critically examining how privilege moves in their lives or the lives of others. So critically thinking about those things. So we need to understand that you can't force people to engage, but if you're facilitating an event where there's engagement, it's really important to still challenge, right? To still kind of bring it up, to ask or pose a question to the group to try to get people to engage that may seem like they're not engaging in that part of the puzzle, because it's important to actively encourage researchers and patient partners, especially those who inhabit social locations associated with unearned privileges, to be aware of what factors influence their decisions about whether to challenge themselves on a given issue or not. So when people decide that they don't want to engage on a certain issue, we want to challenge people to think about why they've chosen not to engage. What is it about this that they've chosen to back off on? So keeping that piece of the puzzle. Respect seems to be something that always comes up in safe spaces, and oftentimes when we're having that conversation at the beginning with patient partners and health researchers, respect, everybody agrees right away, like, of course, respect is like the most important piece of the puzzle. But there is, how we define respect is really important to have that conversation and probe it a little bit deeper than just like, okay, ground rule, respect, everybody agree, we'll move forward. Because everybody's willing to adopt that right away. So it's important to have a conversation around what respect looks like to them. How does someone demonstrate respect to you? And delving into those questions, so we can reveal some of our different cultural understandings around that, and how the term in assumptions may be done, right? Because there are often times where certain people will say respect is not interrupting me or talking over top of me, but in certain cultures, interrupting and talking is actually a part of lively debate. So having that clear conversation around what does respect mean to me and how do I show it to one another is really important. And it also, again, goes back to some of our other conversations around we can respectfully challenge people, and it's not, and you can't use that, say, well, I feel disrespected because you challenge one of my viewpoints. So just having that very clear, what does respect mean, and that challenging someone is not disrespectful. Another piece of the puzzle is no personal attacks. So that one's usually something we can agree on right away, right? No group is going to agree to personal attacks. So we often just checkbox it and say, okay, as a group, we're going to come together and there's going to be no personal attacks. And we need to delve into that a little bit more when you're facilitating these types of groups, to have that conversation around, well, what does that actually mean? How would you define, what would be an example? And of course, people typically will use examples like, well, if someone says I'm an idiot or a jerk, or your idea is worthless, or those types of things, that's a personal attack. And so it's good to have that conversation. Okay, how do you define it? However, you have to think about conversations where you're being challenged and whether that's a personal attack or not. So if someone said something that you said made me feel angry, that's not a personal attack. It's something you said that made somebody feel angry. Or I find that idea kind of heterosexist. That's not a personal attack. That's talking about, that's challenging something you've said. And so having that conversation around what is a personal attack and what is not is always good to clarify from the get-go, so that people can have those thoughts and conversations. Now, one of an example we're going to get into, and it may be uncomfortable for some of our health researchers and patient partners who are white, but we're going to talk about a specific example of when these types of things occur. When about 4 or 5 years ago, when I started presenting on intersectionality, there used to be an ongoing joke amongst my coworkers that it wasn't a great presentation or workshop by Carolyn unless she made someone cry or yell. And this was actually an odd, at the time, I thought it was such an odd phenomenon that every time I presented or did a workshop, someone would yell at me or get really, really upset and cry and leave the space. And there was a theme to it all. It was typically a white researcher, patient partner, or healthcare decision maker. There was a gender piece of the puzzle. Typically, white men would yell at me or argue with me. Typically, women would cry and leave the room. And for the longest time, I'm like, I don't understand. Like, all we're talking about is systems of power and oppression. We're just talking about privilege and understanding our own social location. But for some reason, it brought up these intense emotions. And so then I read a little bit from Robin DiAngelo, who, for our Manitoba people, she was here last week, which was super exciting. And then I started realizing, oh, so this is what it is. This is what's happening when this when this comes up. And it still does come up, even in patient and public engagement that we do nowadays as well. And the whole term white fragility, have people heard of white fragility or the term before? So some of you guys have. So some may have read. The book is amazing, and I would encourage everyone to read the book. It's essentially saying, as white people, I am a white settler as well, in case people can't, that you live in a social environment that protects and kind of insulates you from any type of race-based stress. And so this insulated environment of racial protection kind of builds white expectations for comfort, and while at the same time lowering your ability to tolerate any type of racial stress. So any type of bringing up that you have privilege, or that all of those pieces of puzzle automatically bring up all of these super strong kind of emotions that come up. And so white fragility is a state in which even a minimum amount of racial trait becomes intolerable, triggering a range of defensive moves, right? Yelling, leaving the room, disengaging, getting out of there because you feel super uncomfortable having the conversation. And so that's some of the outward displays, arguing, silence. But these moves actually reinsert, right, again, the kind of system of power and privilege, because you don't have to actually talk about it, right? You end up leaving the room. You don't have to reflect on these pieces of the puzzle at all. And it's because, if you think about it, the coin that I showed before, the people at the top oftentimes are kind of, it's invisible. You don't think about all the different unearned privileges and advantages you have based on this.
And this has happened even in other environments like sexism, heteronormative, like all sorts of other environments. But with white fragility, it comes out quite strongly. So typically what happens is feelings erupt. People feel, oftentimes when people feel like they're singled out, I'm being attacked, I'm being silenced, I feel guilty, I feel like somebody's accusing me. So if they're being called out, so you say something, somebody calls it out, and then this starts happening. These intense feelings happen. Then the behaviors are start crying, want to physically leave, emotionally withdraw, arguing, denying, focusing on intentions. Remember our conversation around intentions versus impact? If somebody says something you said impacted me negatively, then you're trying to focus on, well, that wasn't my intention, you misunderstood me, and then avoiding. And there's a lot of claims that start coming, like, oh, you're judging me, I'm dedicated to anti-racist practice, how could you say that I'm saying this? Well, the real oppression is in naming all these things, and this is a whole list from the group. This is a massive slide, but there's underlying pieces of the puzzle and underlying assumptions that come to it. But overall, the function is to shut off the conversation, to close off any self-reflection, right? You're not going to go back and think about what you said, or go and learn what it is you said, that's why it's harmful. It's trivializing the reality of racism. It's silencing the discussion that we were going to have. It's trying to make yourself the victim. It's hijacking the conversation. So I've had to shut down engagement events sometimes to go look after somebody who has left the room or is upset, versus having a real conversation. If someone's talking about systemic racism they've endured, I'm now concentrating on the person who's left the room and not concentrating on the real conversation going on. It protects our a limited worldview, and it takes race off the table, and all of these different, and it focuses on the messenger, so the person who gave the feedback and not the message that they were giving. And it rallies resources around people. So D'Angelo proposes we flip the paradigm. And this paradigm can be flipped on a number of different things as well. But as far as racism, thinking that racism is the norm rather than an aberration, and that feedback is key to our ability to recognize and repair our inevitable and often unaware collusion in racism. So understanding people have been socialized in these systems, people will say things, and that feedback is an important learning opportunity versus some kind of attack, right? So instead, we receive feedback from people by saying how, where, and when you give me feedback is completely irrelevant. Doesn't matter, you can give it to me anytime. It is the feedback I want, and it's the feedback I need as an individual, because I want to keep learning and growing and working towards anti-racism. So if you're going to give me feedback on something I said, that is amazing. Thank you for having the courage to actually tell me that, and I am open to receiving it. Understanding that it's hard to give that kind of feedback to someone else, I'm going to take it away, and I will take it any way that I can get it. From my position of social, cultural, and institutional white privilege and power, I'm perfectly safe, and I can handle receiving this feedback. It's okay. I'm okay. And if I cannot handle it, it's on me to build my stamina, right? It's not on the other person. It's on me to be able to take that feedback and work. And thank you for giving feedback to me, right? And this applies to all sorts of things, like sexism, wherever. If you're being challenged, thank you for that. I'm going to take that, and I'm going to learn and understand how to be better. The feelings then switch, right? I'm grateful. Thank you for actually having the courage and coming and telling me this. Excitement, I get to learn more. Discomfort still, guilt still, you're still going to feel kind of like, I can't believe I did that. But motivation to learn and change, some humility, compassion, and interest. And when you do that, the behaviors that change or that I'm going to start reflecting on things. I'm going to seek more understanding. I'm going to read some books. I'm going to look up stuff. There's tons of information on anti-racist practice written by people of color, Indigenous people, and white people as well, all talking about how to be better. I'm going to apologize for my behavior. I'm going to do some grappling, I'm sure, on my own. I'm going to listen. I'm going to engage. I'm going to process, and I'm going to believe when someone's giving me that information and not try to deny. So the claims then, I appreciate. This is super helpful. It's my responsibility to resist getting defensive or complacent. This is hard, but it's really important. Oops. When you get called out, like, oh, wow, I didn't realize. It's inevitable that I have this pattern. I want to change it. It's personal, but it's not strictly personal. I'm going to focus on the message that I'm receiving. I'm not going to try to get at the messenger. I need to build my capacity to endure discomfort, and I got to bear witness to the pain of racism. And I have a lot of work to do still. And what you'll find, I think, in patient and public engagement, whether you're a health researcher or a patient partner, a lot of times those are things that you walk away like, oh, God, I got some work to do. A lot of the time, and that's okay. Oh, goodness, the assumptions. I will send out all of those pieces. And by doing this, we minimize our defensiveness, right? We demonstrate our vulnerability. We demonstrate that we're curious, that we have humility. We allow for growth. We stretch our worldview. We ensure that we actually take action and don't just say it. We demonstrate that we can practice what we profess to value and that we can build authentic relationships and trust. So when it surfaces, a lot of times, and this goes for everything. If you're ever being challenged, take a deep breath, listen to what people are saying versus, I know sometimes the mind starts running with a bunch of excuses, like, wait a minute, no. But listen, reflect, return to that list of underlying assumptions. Seek out someone with a stronger analysis if you're feeling confused. That doesn't mean the person who's challenging you, don't start being like, well, teach me. It's more about seeking out, talk to some of your friends who may be in anti-racist practice, who are doing amazing work on the ground. Talk to them so maybe you can clarify certain pieces of the puzzle, take time to process, but also return to the situation and the people who are involved in the incident in the first place and have that conversation after you've had some time to reflect. Because remember, the vulnerability piece of the puzzle is super important. Now, I didn't want to just leave everyone off there and be like, here you go. I want to also talk about self-care, because self-care is an important part for all of us, whether we're health researchers, whether we're patient partners. We have to think about self-care as well, because an integral part of patient and public engagement is bearing witness to people's stories and their experiential knowledge. And sometimes there are issues around trauma, around systemic oppression that you have to take in and listen and bear witness to. So it's important to, first of all, remind yourself that you bear witness to people's stories all day long, every day, whenever you interact with other people. But you're being asked to powerfully uphold some space for patient partner and caregivers' right to take up that space and have their stories heard, and letting partners know that their experiences matter to them and matter to the research that you're doing. And incorporating strengths-based pieces of the puzzles, affirmations. When people tell you their story, having those, acknowledging everything that they're bringing to the project, acknowledging the strengths that they built, offering appreciation and understanding for what people are going through, and recognizing success, right? When as a team we work together. And grounding in self-care. This is something that, of course, we don't always talk about, so having a variety. So for people engaged, whether you're a researcher or a patient partner, having a variety in your day. We've learned this through patient engagement, having back-to-back engagement sessions without time to process or to do something a little bit different, switch it up once in a while, can be super hard. So scheduling your day so that you can have a little bit of variety. Maybe you need some alone time in your office or in your cubicle, or you need a mix of research and doing a little training or having different types of conversations with different people. But doing this is actually self-care. Attending continuing education sessions around mindfulness-based stress reduction techniques, taking scheduled breaks in your day to do reflection, to socialize with others, exercise, eating, or just getting away from whatever work you're doing. Developing a personal debriefing plan is a huge one. I think whenever you're engaging on both sides, have a plan to connect later on and debrief about it. I know with us here, oftentimes we encourage health researchers to come on down and have a conversation on how things are going, just to debrief and process. So with your peers or your supervisor or anyone. And then setting realistic goals, not doing the back-to-back engagement, but taking times and giving yourself enough space to process it. Because you want, it's good for everyone, whether you're a health researcher or a patient partner, that you take time to process and build these things in your day. And this is actually an activity we typically do at the end of engagement pieces of puzzle that actually health researchers enjoy just as much as patient partners. So at the end of a session, we sometimes say final thoughts. So we do wrap up. And then one nice thing that you're going to do for yourself today. And oftentimes people aren't asked that, right? So you'll find it stuff like just going home, cuddling with the dog, or watching a movie, or doing something for yourself. But emphasizing that piece of the puzzle. Patient and public engagement can be really hard work. And to actually have meaningful engagement and meaningful conversations and being able to challenge each other, it's tough sometimes. And so building around that self-care and that understanding and compassion for yourselves and others is really important. Questions? That's a lot of... Oh, God.
If you want to do questions, if you don't mind, people online to be able to hear.
Oh.
Wearing a little bit of
Oh.
so she's going to do like I did.
Hello. Oh, yes. I'm not going to put my chest in your face.
Okay.
Hello.
I think just a comment, we also have a resource list that we carry with us anytime we facilitate. People do share their stories, and I guess just being aware that we don't need to have a dual hat on and having boundaries for yourself as well, and how much you can take and how much you can't, and not being afraid to give a resource list to folks where they can access supports that patient partners might need, and not having to feel guilty about doing that. Again, not having that dual relationship.
That's an
And
awesome
can I share
point.
one story?
Yeah.
Because when you were, it just kind of reminded me. So talking about, for my partner, he's white. I am brown, and so a lot of times I have to think a lot about racism and systemic issues that he's not even aware of. He's completely unconscious because he doesn't have to think about it, nor is he faced with the struggles. So we were crossing the border. And here I am being like, oh my gosh, my passport says I'm born from Afghanistan. Are they going to let me in? And in that moment, he had an aha moment of, wow, I never have to think about that. And had I not listened to you, I would never even know that people actually think about that. So I think being an ally, he's my ally. And that's important too when it comes to racism. If you hear another person saying something that is racist, it's important to put a stop, because a lot of people say it unconsciously without knowing that. Bringing that to their conscious mind is important. That's the first step to making a behavior change, and then being an ally. Yeah. Even all of you sitting here today listening to this is great. Thank you, Carolyn.
Thank you, Guy. Were there other questions? Sorry, I'm like connected.
Yeah, thanks for this, Carolyn. I think that was such a good list and slides that you put up there of the things we can do to respond when we're challenged. I'm also wondering, because it also seems like probably a very difficult thing for people to do, and as facilitators, how we could support that process for other people, if you have any thoughts about that.
Yes, that's a really good question from Ashley. So as facilitators, how can we help when people are being challenged and creating that space to kind of um, start having those pieces of the puzzle? First of all, I think it starts with some of those conversations at the very beginning around intentions versus impacts and having some of those ground rules in place so that if something starts coming up, we can go back to those ground rules that we all had a conversation around whether this is a personal attack or whether this is you're being called out for something, and then taking the time to point it out. Sometimes it's hard when you're facilitating patient engagement and these things erupt, and taking that time to both check on both sides and have that conversation a little bit more. I think having some of those ground rules in place will help to mitigate by saying, okay, remember when we talked about at the very beginning when we got together around the difference between respectful and not, and that this is an actual challenge, this isn't a personal attack, and that we want to have this conversation in a good way. For those pieces of the puzzle, to take deep breaths, to give those points, and then to try to keep everyone together. But there may be times, a lot of times we facilitate in groups of two so that we do have another person that can run out with someone. If someone does disengage, how to have a conversation around re-engaging and what it's going to take, but also pointing out the difference between intention and impact, and that sometimes you may have the best of intentions and come in and it completely shocks your system when you realize you've said something harmful, and having that conversation around you're safe, you're being challenged, I know it's uncomfortable, we're going to work through this together, and leading those conversations. And also, I think as a facilitator, not letting those conversations just go on, like being able to point out and support someone who did have the courage to call something out, to give them a little, to also be an ally in that way and say, okay, there's something that's been brought to the table that we do need to address and work against the kind of defensive moves that may start occurring. It takes a lot of compassion and takes a lot of kind of going back and forth, and sometimes you're not going to be perfect, and afterwards you're like, oh God, I should have reacted this way or done it this way, but just kind of, I think setting some of those ground rules at the beginning so that you can reference back to them when it's starting to devolve is a good piece of the puzzle.
And I love how you talk about reflexivity as not a facilitator, but as a group members. We encourage, so if these feelings are coming out and people are disengaged, running away, is to, if we can't get a hold of that individual, we still have to facilitate the group. You can always follow up, but asking the person to then start kind of unpacking some of their emotions towards what's causing them to feel the way they're feeling, what's triggering for them, and let them process and reflect, and really look at what's going on for them to start kind of looking at their own feelings of why am I so defensive? What's bugging me about this topic area?
Okay. Oh, okay. Oh.
We just have a question from online.
Okay.
So Jason asked, does stamina building involve growing pains in a great space environment?
Absolutely. So the question was, does stamina involve growing pains? Oh my goodness, does it ever, right? So building stamina. And here's the biggest thing, I think, is that as beings, we are never done learning, and we can never say we're fully like, I know everything now, right? We're always going to be learning. There's always going to be moments where we're like, oh my goodness, I can't believe I just said that, and I'm being called out. It's how you receive that feedback. Also, making sure that you read and do lots of that work on your own as well. It's on you. It's on you to build the stamina, and whenever you do get called out, then take that feedback. Be grateful that somebody had the courage to give you that feedback, and then go and learn and keep learning and keep learning. And yes, there's going to be times where you're like, oh my, I can't believe, but you keep just growing. So it's definitely, that's a very good point, Jason, about the growing pains. Alex. Oh, you're the, yeah, that's all.
Were there any other questions? We're good. Thank you so much for joining us today. Trish, do we have someone from March, or should I announce March's monthly lunchtime?
Yes, March 12th.
March 12th is our next monthly lunchtime learning series. It's a Thursday, and it's going to be a case study of one of our award winners. So they're going to come and talk about their engagement. So if you joined us, you will probably get an email about that. Thank you so much again.